Welcome to Ventricular. Today we are going to discuss regulations of heart pumping. So first of all, if we see in normal situation, the cardiac output is 4 to 6 liter per minute. That in normal situation, heart eject blood 4 to 6 liter in just 1 minute. But when someone do some exercise, during that situation, the cardiac output increase 4 to 7 times than the normal value. So in normal situation, the heart regulates its pumping through two different mechanisms. First one is the intrinsic cardiac regulation and second one is the autonomic nervous system, in which you will see the sympathetic and parasympathetic system. But in this lecture, we will just focus on the intrinsic cardiac regulation. And we discuss intrinsic cardiac regulation through the mechanism, and that is Frank-Starling mechanism. So actually two physiologists that presented this law is the Otto Frank and Ernest Starling. This law says that more the blood enter into the heart, more the blood will be ejected from the heart. So this is the case. Okay. It's mean that more the venous return, more will be the cardiac output. So if I say in the steady state or in the equilibrium state, when I say that the 4 liter blood enter into the heart, 4 liter blood will be ejected from the heart. Okay. When more amount of the blood enter, more blood will be released. So when the 6 liter of blood enter into the heart, 6 liter of blood will be ejected from the heart. This is actually the equilibrium. It's not always be the equal venous return and cardiac output. So if I say that the venous return will not always be equal to the cardiac output. So this is the case. Okay. Actually, the question is, what changes heart do during the more blood entering into the heart? So in that situation, first of all, when the blood enter into the heart muscle is stretched. This is the one thing. Just like when we put the air into the balloon start expanding. Similarly, when the blood enter into the heart muscle start stretching. Second thing is the force of contraction. When the more stretch happens, then after that when the heart muscle contract, the more will be the contract. Okay. And after that the blood eject from the heart. This is the case. Just like a balloon, if I say here is the balloon, okay, and in that situation, more the air enter into the balloon, and after that when I compress this balloon, more the air will be ejected from the heart. This is similar to the heart. More blood enter into the heart, more stretching of the heart muscle, after that more contractions of the heart muscle and the more volume of the blood ejected from the heart. So this is actually the Frank-Starling mechanism. But there is another factor that is actually involved in the pumping of the heart as well. So that is the arterial pressure. So if I say that this is the right atrium, right ventricle, left atrium, left ventricle. So if I say when the arterial pressure increase, then the heart rate and the blood volume will also be increased. Then how? So if you see here, when the blood enter into the right atrium from the inferior and the superior vena cava and enter into the right atrium. Okay, this is the first thing. When the right atrium contract, the blood enter into the ventricle, right ventricle. So it's mean that when the arterial pressure increase, more blood enter into the, and more blood ultimately ejected from the pulmonary trunk, and if I say at the left side from the aorta. So this is the case. Arterial pressure involved in the large amount of the blood ejected from the heart. And second rate, heart rate will also be increased, that is 10 to 20% will also be increased. But the contribution of the arterial pressure is small as compared to the intrinsic property of the heart. Okay, next if we discuss the ventricular function curve, two important things which you have to remember. First is the work output and second is the volume output. So first of all, if we see that the stroke work output curve, if you notice on the word that the stroke means beat, that in one beat, work output, it's mean that the heart do some work in just one beat, that is called stroke work output. Okay, we discuss it on the left ventricle and right ventricle. Okay, so if you see on the x-axis, we take the mean arterial pressure will be in millimeter mercury, and on the y-axis we take the stroke work output, and that will be in the gram meter. Gram meter is actually the unit of the work. Okay, first of all we discuss the left ventricle. So in that situation, if you see 10 20 millimeter mercury, and on the y-axis 10 20 30 40 gram meter. Okay, it's mean that when the arterial pressure increase, the work output, stroke work output will also be increased. So if you see here at the left side, here is the left side, at the left side, when the arterial pressure, when the atria contract, then the pressure on the blood that is actually present in the atrium will also be increased, and the blood start moving into the ventricle. So actually when more atria contract, more pressure will be generated and more blood enter into the left ventricle. And after that, when the more blood enter into the ventricle, and the ventricle start stretching, and more the after that you will see the ventricle start contract with greater force. So this is the case. That's why you see that in the left side you will see the work output is high. Okay, if we see the right side, you see the arterial pressure and the stroke work output. So in that situation, you see the just different, that it is actually a hypothetical values. You see that on the right side you see the 4 gram meter, and on the left side you see the 40. So it's mean that the left ventricle do more work as compared to the right ventricle. Why? Because left ventricle has to provide blood to whole body as compared to the right side, because right side blood provide to the lungs. From the, as you see the from the right side, the blood goes towards the lungs, but from the left side the blood has to go to all the body or all body tissues. So this is actually the stroke work output. More arterial pressure, more stroke work output, but within a limit of the ventricle. Next is the volume work output. So in that situation, we take the arterial pressure on the x-axis, that is in the millimeter mercury, and the volume output on the y-axis. Okay, that is liter per minute. Okay, if you see that the arterial pressure is 0, +4, +8, +12 and -4. On the y-axis you see the 5, 10 and 15. So if you see at the right side, at the right ventricle and left ventricle. So if you see here, if I say at the 10 volume output, at the 10 liter per minute output of the ventricle, then in that situation you will see the arterial pressure is different. This is the case. Okay, in that situation, at the right side the arterial pressure is small, and at the left side you see the arterial pressure is large. Why? Because to move the blood from the right atrium into the right ventricle, you just have, or you just require small arterial pressure, and after that the blood move towards the lungs. Okay, but when you have to provide the blood from the left atrium into the left ventricle and ultimately into the to the body, then in that situation you require the more arterial pressure. So it's mean that the similar amount of the same amount of the blood ejected from the atria into the ventricle, the pressure of the atrial will be different in both left and right side. So if I say that the 3 liter and 3 liter blood ejected from the atria into the ventricle, so in that situation right side requires more arterial pressure compared to the left side. So left side arterial pressure is more as compared to the right side. Okay, that's why the left side curve require more arterial pressure compared to the right side. So this is all about the regulations of the heart pumping. If you have any question, you may ask in the comment section. Thank you so much.